scans, you've drawn a sample of blood, and when you run your test, you find that there's more unconjugated bilirubin in the blood. Where do you think the level of obstruction is taking place? Is it hepatic? Is it post-hepatic? Is it pre-hepatic? If it's unconjugated, most likely it's pre-hepatic, isn't it? So the condition there, what you should look for is what is causing the hemolysis to increase, the breaking down of the red blood cells. Because it's happening before, it's unconjugated, it's pure bilirubin. In the liver, sometimes you may also have some unconjugated bilirubin, because sometimes there's cancer of the liver, there's cirrhosis, a condition that is affecting the liver, so you're not getting much of it. So the bilirubin that is supposed to be conjugated is not being conjugated, and it leaks back into the blood. Then you may have a complete completion of conjugation, but it's not being separated into the gallbladder. So it just goes up. Regurgitation jaundice, as it is called. So that jaundice, the bilirubin that is piling up is going to be sent back into the blood. So in all these, you end up having yellowing of the skin and of the eyes. Okay, we end here, and I've got two questions on slide number 31, as always. So once you answer those questions, we can work out. The first question says, which enzyme, these are like sample questions, just to show you how questions come.
It's very good.
Which enzyme below is deficient in erythropoietic protoporphyria? You remember that table that I said you should check? A, delta aminolevalinic acid synthase 1. B, uroporphyrogen synthase 3. C, protoporphyrogen oxidase. D, ferrocarotene. And number 2 says the intravenous administration of Heme is required for reducing symptoms during acute porphyria attacks. Heme decreases gene synthesis of A, delta aminolevalinic acid synthase 1, B, uroporphyrogen synthase 3, C, protoporphyrogen oxidase, and D, ferrocarotene. So the answer for the first question, you all have questions, don't you? What's the answer for the first question?
D.
Sorry?
D.
Okay. You sure? Yes. Okay. You've checked the table?
Yes.
And D? Sorry, question 2? Question 2? So you check the slide that talks about regulation, because that's where I construct the question from that slide, where it talks about regulation. So which enzyme is targeted by Heme or hematin? Yes? So what's the answer? How many are saying it's A?
How many don't know?
How many are not sure? How many will be sure after class? Okay. Please practice this. I'm sure after going through the notes, you'll be able to get it. In case you have any questions, I've shared my email with the first one. You can email me. Thank you very much.